Now, the 90% increase in suicides for Gauteng is not accurate. The South African Depression and Anxiety Group says the number is much higher. It says this is based on the high volume of calls to its helplines. More than 2,500 calls are received each day, and 1 in every 5 calls are suicide calls. Let's speak to SADAG's Cassey Chambers now. Ms. Chambers, good afternoon, and thank you very much for your time. So whatever the numbers that we are seeing, for example, that there's a 90% increase in suicides in Gauteng province, you say that's low, really, is lower than the real numbers.
Good afternoon, Dev. And I think what's really important when we see all these stats and when we hear something as shocking as 90% increase, I think that alarms a lot of people. But I think we also have to understand, where do these stats come from? How did we come up to these numbers? Because normally it's been really difficult to come up or to get stats from different government departments. There'd probably be varying stats from the Department of Health to Department of Social Development. So it's important for us to really understand, how did we come about these figures? We know that they're from 2019 to 2020. But what we also know in South Africa is that our mental health, especially our suicide rates, are very underreported. So on the ground, that these stats are actually a lot higher. And if we can relate it to anything of what we're receiving in the SADAG call center, where our call volumes have doubled and tripled over the last 20 months, I think it is very concerning. But when we talk about these stats, we must never forget that these numbers are people. And for every one suicide, there are families that have been devastated, a brother or sister or a mother who's been lost. So I think we must be very careful about what these numbers and these stats mean to us on the ground.
Okay, when I saw that myself, and I think it was doing the rounds on social media, when I saw the 90%, I was thinking, that's very high. It's almost double, and it's only one province. So I was thinking, what is the national picture? From what SADAG knows, I mean, how bad is suicide in South Africa? I mean, so much data gets shared around on social media platforms, including the fact that South African men commit more suicides than any other man anywhere else in the world.
And I think this is when we're looking at these stats, and exactly what you did is you critically look at it. How does this relate to the whole country? What does it look like? We know that according to the WHO, that South African men are 4 times more likely to die by suicide than women. So we know that suicide is an issue in South Africa. I think when we see something like 90% increase, we also have to take it from the year before. And how were those stats recorded? And why is there a 90%? Is that a 90% increase in the research that we have and the data capturing versus what's on the ground? What we know is that suicide is an issue in every province in South Africa. We know that we had a mental health crisis before COVID, and we know that COVID has negatively impacted every aspect of our mental health, especially for majority of South Africans. And I think when we look at our call volumes at the moment, before COVID, we were 600 calls per day. We're now well over 2,500 calls each and every single day, excluding the number of emails and SMSs. 1 in every 5th call, 1 in every 5 calls are related to suicide. So yes, this is a real issue and a real concern. And when we hear these stats, we need to say, what are we doing about it? How do we create more awareness? How do we prevent these suicides from happening and from families to be devastated or communities to be impacted? We as South Africa, as every province, should be doing better for suicide prevention.
From what you've just said, that will tell me we're not doing enough to reach out and support people. What should we be focusing on?
Everyone can play a role. We can all be aware of the signs and symptoms to look out for. We can all learn how to have safe conversations. If you're concerned about a loved one, a child, a colleague, a family member, to start that conversation and say, I'm really worried about you. Are you okay? Are you struggling? I want to get you help. I think the more we destigmatize mental health and suicide, the more we encourage more people to reach out. I think it's also linking them to help before it's too late. Reaching out to SADAG Suicide Crisis Helpline, speaking to your doctor, going to the primary healthcare clinic. Don't wait. Depression doesn't go away overnight. Learn the signs and symptoms, encourage people to get help, and start that conversation. Especially this time of the year, we're going into a very difficult season for many people. It's now that we need to start these conversations before something serious happens.